Your baby has arrived. Here's what to expect during your baby's first month of life. Unlike yours, your baby's eyes are swollen from delivery, and perhaps the protective antibiotic eye ointment administered after birth. From a flattened nose to a cone-shaped head, especially prominent if you were pushing for a long time, the baby is cute as she is, and your baby will change quickly over the following weeks. Though your baby may have weighed in at 3.5 kilograms at birth, don't be surprised if she drops some weight. Your baby's weight should stop dropping by the time she's 5 days old. By around 10 to 14 days, she'll regain and surpass her birth weight. The average newborn sleeps about 15 hours between daytime and nighttime snoozing, though there's a wide range of what's normal. Breastfed babies typically need to eat every 2 to 3 hours, and formula-fed babies usually eat every 3 to 4 hours. Feed your baby on demand, rather than by the clock, though. After a month, you may be able to spread out feedings a little more. Worried about that swollen scrotum or those swollen labia? It's perfectly normal and temporary. They're due to hormones of yours still circulating in your baby's body. Those same hormones are also responsible for any milky discharge leaking from the nipples and vaginal discharge, which can sometimes be tinged with blood. As with the swelling, the discharge should go away within a week or two. How much milk baby needs? Babies eat a lot during those first few weeks, at least 8 to 12 times in a 24-hour period. If your baby seems happy, her weight gain is appropriate for her age, and she's making enough dirty diapers 8 to 12 on any given day, she's probably getting enough. First poops are usually black and sticky. That's the meconium that filled your baby's intestines while in utero. That will transition after a day or two to greenish-yellow stools, and a few days later to regular baby poops. Your baby's poop should look mustard yellow, green or brown, and it'll be pasty or seedy. Make sure she isn't hungry, doesn't need a diaper change, and hasn't had something uncomfortable happen. If all that is in check, help her through it the best you can. Rock her, walk her, sing to her or cuddle her. While colic usually starts around week 2 or 3 of a baby's life, it most often peaks in severity around week 6. By month 3 or 4, your baby likely won't be crying any more than any other baby. So remember, when you think you can't take much more crying, it's just a stage. The umbilical cord fall off within the first few weeks of your little one's life. Until then, make sure to keep it clean and dry. Come back if you notice foul-smelling discharge or the site still looks open and raw 2 weeks after the cord has fallen off.